Welcome to Channel 17, the Town of Colonie Government Channel.
Hi, my name is Michael Dailey, and I'm the Medical Director for the Colonie Department of Emergency Medical Services, Colonie EMS. We're here today to talk to you about CPR, cardiac arrest, and how to get someone who has suffered a cardiac arrest, hopefully get them back. In Colonie, we have a pretty unique program that's working extremely well. We'd like to share that with you. Joining me today is Assistant Chief Jack Bevilacqua from the Colonie EMS department. Jack's going to spend some time talking to you about statistics.
Hi, Michael. Cardiac arrest is so important for people to know what to do when a cardiac arrest happens. It's a little known fact that a lot of people don't do CPR or don't want to learn to do CPR because they're afraid of touching somebody or getting a disease. People don't realize that 95% of the people who go into cardiac arrest outside the hospital do so at home. That means that the people that are around who can make a difference are their loved ones, and they're not learning that, which is a stat that we're trying to change here in the town of Colonie. We initiated a program about 2 years ago about citizen CPR. At that point, I believe our statistics were we had about 80 cardiac arrests. 22 of those we got back in the hospital, got back pulses and their breathing. Only 4 of those came out of the hospital. We only had 1 person who had citizen CPR. Today, the stats are up about 25% of our cardiac arrests have citizen CPR initiated before we get there. Our return of spontaneous circulation has increased tremendously. That is the big difference that we see here in Colonie, is not that we're not doing any super job, it's the citizens that are making a difference. Starting compressions. American Heart said this in 2000, and in 2005 they said CPR is the most important thing that makes a difference in survivability.
There's something called the chain of survival. The chain of survival means each link in that chain has an important role to play in the survival of somebody in a cardiac arrest. A cardiac arrest is when somebody's heart stops. When their heart stops, blood no longer is traveling to their brain, and the brain begins to die. The first step in that chain of survival is citizen CPR. In the town, we've done an excellent job of getting police officers, firefighters, and other town employees trained in first response, which means that they arrive to start CPR, to perform defibrillation, which is where they shock the heart. But the first step of that chain of survival is what we're trying to actively increase now.
And that is important that they start CPR. But recognizing is also part of identifying that there is a problem and calling 911. And some people, what they happen is they feel like, I'm not having a heart attack, or nothing's happening, or they're just sleeping and they're afraid to call 911. Calling 911 will get the resources there. Time is money when we're talking about cardiac arrest, and that's the difference. 1 minute or 2 minutes means a difference from surviving and not surviving. When you call 911, things that happen, they're going to ask you a bunch of questions. We have what's been called Enhanced 911 in the town of Colonie. That means that the information of where they're calling from and their phone number and their address is on there, but they always verify that. Computers nowadays, you never know, garbage in, garbage out, they may not have the correct address because of a computer glitch. So they're going to verify a bunch of information, where they are, what their phone number is, in case they do get disconnected. Then they can call them back and get more pertinent information. But they're going to ask them, what's the problem? Police, fire, EMS. What's the patient's age? Are they breathing? All those questions are going to be asked, why the person's on the phone, but they have another communicator who's going to be starting to dispatch the call. So if you do call 911, don't be afraid that, just send the ambulance. Because why are you asking these questions? The ambulance and the first responders and the police department are already en route as that's going on. There's things that you can do also while you're waiting for us, or why the ambulance is en route, is making sure that you have your medication list out, having the lights on if it's at night, having your house number so it can be seen from the street. All these little things make a difference, and and they only take a second or a couple seconds, make a big difference on the result or the end of the patient's survivability.
That program of emergency medical dispatch with our professional dispatchers here in the town, what they actually will do is they will walk you through the steps of the emergency so that they can train the caller actually in performing skills. But it's a lot better if you've had that skill already. And what they're doing is providing a reminder in how to act in an emergency rather than training you for the first time in the setting of that emergency.
Yeah, and that happens a lot because people are afraid. It's like I learned CPR, 6 months ago or a year ago. What am I supposed to do? Well, I didn't take that class. I took the class through work or through something else. Most people don't realize that when they took the class originally, if they did it, it was for something else, and then all of a sudden they need to use those skills at home. What we've been trying to promote here in the town of Colonie is what's called CPR Anytime. What this is a little kit that comes, one's for adults, one's for infants, and they have a little inflatable mannequin and a DVD that you actually, it's a play and do type program where you put the DVD in and it brings you through learning how to do compressions, how to do ventilations, how to take care of somebody who's choking. And the nice thing about this kit, you can do it as a family. It's designed for your family to do this all together. But if in 6 months, a year, you don't remember how to do it or you have some family time together, you put the DVD in again and you can play it and refresh yourself right there.
I'm a physician, so for me, I do CPR, or in some cases I have other people do CPR while I'm doing other things, but I'm involved in cardiac arrest care on a relatively regular basis. My wife's not. She has no medical training. We took these kits home and practiced at home. It was really interesting for me to see how the kit would work for her as truly a layperson. Blowing up this dummy was a very unique experience, and this dummy actually is remarkably effective at teaching appropriate compressions. The infant dummy or mannequin is also remarkably effective. And actually in 45 minutes, that's 20 minutes for the adult and 22 minutes for the child, accounting, I suppose, for a couple of minutes to change DVDs, she was able to get trained.
And that's an investment for your family. Like we're talking about, all this stuff happens at home. So if you think about that as a family, each kit costs about $30. You can get them on the internet. You just go to American Heart Association and you look for CPR Anytime, and they have these kits in there, and they'll ship them right to you. That's $60 and less than an hour of your time for your family, not for the person you see in the car accident down the street or somebody that you're in the mall. This is an investment for your family, your loved ones, and this is where cardiac arrest is going to happen.
That's really true. That's really true. The other thing that's important is at this point, we've always thought of CPR as cardiopulmonary resuscitation, but if somebody does go down right in front of you, it's kind of gross. I don't want to put my lips on somebody else. And now at this point, it's exciting that the Heart Association is saying that you don't have to. And we're instructing our dispatchers that as well, that what they can teach and they can talk somebody through is hands-only CPR, which is where you are only doing the compressions once you've recognized that somebody is unresponsive.
And I think that is a huge change for people, that it overcomes their fear of having to do mouth-to-mouth, that just doing compressions, that's something you can learn in about 3 seconds. Is the difference, and American Heart's been saying this is what makes the difference, doing compressions. And compression-only CPR is so huge, and we're seeing it here in the town, that makes a difference.
No, that's certainly true. It's probably a good idea. Why don't we demonstrate some hands-only CPR for everybody? Take a minute and do that.
Excellent.
What Jack's going to start showing us is the process of a CPR situation where someone has gone down, is in cardiac arrest, and you need to begin to recognize what's going on and then act. Jack.
Okay. Identification that somebody's in a cardiac arrest is very important. So when you approach the patient, are you all right? Are you all right? I have no response. Call 911, get the AED.
Always make sure you're directing somebody specifically to call 911. Pick one person out of a crowd if there's a lot of people around. Because if you don't, what'll happen is nobody will do it.
I am only doing compression-only CPR. They're not breathing. I'll go just below the nipple line and compress. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10.
You'll notice that Jack is bending from the waist. He's doing compressions just below the nipple line with both of his hands stacked on top of each other. And he's compressing about 2 inches and then coming back completely up on the chest wall to allow the heart to refill with blood. And you can see this is actually quite a lot of work in order to do this efficiently. You certainly will get tired doing this relatively quickly. But the important thing to recognize is help is on the way. And the rescuers are on their way to you as long as someone has called 911.
You'll do CPR for approximately 2 minutes, and then you'll stop and check to make sure that they're not breathing. After 2 minutes, we try and rotate people. As you see, I just did CPR for about 1 minute, and it's very exhausting. What you try and do is rotate people through so you do good CPR all the time. What we try to ask people to do, the citizens, is give us your best 4 minutes. Because in the town of Colonie, we average about 4 minutes response time from the time that you call 911 till we get there. So we're asking you to do CPR for 4 minutes.
What we've found with our cardiac arrests that are getting bystander CPR in Colonie is a great proportion of these folks are going home. And this is not home to a nursing home, this is home to their loved ones. The first step of the chain of survival is recognition. The next step is citizen CPR. Learn CPR, get one of these kits and train your loved ones. The person you train may end up doing CPR on you. It's extraordinarily important. This is a way we're going to save lives.
Okay, Mike, now we know, we've told them that the CPR is very important, and for us to get there within a timely manner is so important for the success of the whole call and for the patient to survive. There's a lot of changes that are coming down the pipe from American Heart. What in Colonie, Mass are we going to be doing maybe a little differently they haven't done in the past?
Colonie has always been on the cutting edge of EMS care in New York State. It's actually remarkable how we've seen such increases in our return to spontaneous circulation rates over the course of the last 3 or 4 years. And we can really track that back to the training and education that we're providing to the paramedics and EMTs in the street, and the training programs that we're running to make sure every year that we're reviewing how a cardiac arrest can most efficiently be run to follow all of the evidence that we have from the journals and save people as efficiently as possible. From the time that somebody initially gets care from Colonie EMS, what we're going to do is we're going to maximize compressions. We're going to use mechanical CPR here in the town, which is a machine that does those compressions for you. As you know, you got very tired doing those compressions there. Maybe you want to describe the thumper really quickly for them, if you would.
Well, a thumper is a pneumatic device. It looks very archaic. It's driven by oxygen, and it actually does compressions just like a plunger up and down. But it does perfect CPR every time, and it doesn't get tired.
Right.
It does very, very good CPR.
What we've learned is that doing appropriate, adequate, really good compressions can optimize outcomes. That's one of the tools that we use. One of the other tools that we then use is we make sure that we're not over-ventilating a person. We used to think a little bit of oxygen is good, a lot of oxygen must be better. And what we've subsequently learned is that actually over-breathing for somebody during a case of a cardiac arrest is bad. So we spend a lot of time training our providers to make sure that they're not over-ventilating in cardiac arrest. And we use some different breathing tubes sometimes to help make sure that we're ventilating appropriately. And we use other devices that we've learned along the line will work to do that too. Can you describe one of our transport ventilators, please?
The transport ventilator it's a tool that's used that's small, that just actually ventilates the patient at a consistent rate and a consistent volume. Like you mentioned before, with little oxygen, good, a lot of oxygen, great. And we're finding through the studies from American Heart that that's not true, that this gives us a nice set tidal volume, which is how much air actually goes in, so that we don't overinflate the patient, which comes into a huge change for the outcome.
That's really important. One of the other things that we do is we have really advanced monitoring that we're using with our patients now. The advanced monitoring that we have is actually as good as that patients would get in many of the ICUs in the area. with monitoring of their saturation of the blood with oxygen, monitoring their cardiac activity, looking at the electrical activity of their heart, also looking at the carbon dioxide that they're blowing off as they breathe. Following that carbon dioxide that someone's blowing off, we can make sure that we're adjusting the ventilations to be sure that we're adequately ventilating and not over-ventilating the patient. It gives us a huge amount of information for that resuscitation. The other thing that we can do now, which is really remarkable, is that we can do a 12-lead EKG, just like you'd get in your doctor's office, and we can then transmit that directly to one of the cardiac centers that we have in the area. There are 3 hospitals in the area, as you know, that do cardiac catheterization: Albany Medical Center, Ellis, and St. Peter's. Each of those facilities is set up to receive an EKG that we would transmit in from the field. Remarkably, each of those facilities is also trained to do something else now, which we've been doing in the area since the first case that came out of Colonie back in January. And this is actually a remarkable process in its simplicity. It's called therapeutic hypothermia. And what we do in therapeutic hypothermia is we chill a person's body down to 92 degrees Fahrenheit. When we chill them down to 92 degrees Fahrenheit from the 98.6 that they normally are at, what happens is their brain goes on a, if you will, a brain vacation. This process has worked remarkably well at increasing the number of people that not only get their hearts beating again, but re-achieve their baseline neurologic status, or their brains go back to normal after a cardiac arrest. We saw that in our first case. We've seen that in many other cases since then, and this certainly is an important part of what we're doing here in the capital region. What we're going to start doing in the town, potentially as early as next week, is actually initiating that therapeutic hypothermia in the field, as opposed to waiting until a patient gets to the hospital. We anticipate that that will actually help our outcomes get even better.
These changes, I think back from when I started back in the early 80s of doing CPR and how much resuscitation and cardiac arrest patients has changed. People have to realize that there are many things that we can do at the house to make a difference. And we know traditionally we used to go just to the closest hospital. We'd pick them up in what we would call the scoop and run and just go to the closest hospital. We do a lot of more procedures on the scene now, and we may not go to the closest hospital. We may go to one of the cath labs to help change the outcome to increase our survivability. And I think that's what people have to understand, that when we're on the scene, we may stay there a little longer than we used to. That's because we're doing things, and you mentioned we do things that they only do in the ICU, that we do out into the field to make a difference. And I think we've come a long way in the last 30 years for cardiac arrest management.
You're right. You're right.
Yeah.
It's really important to recognize when we make a decision to transport, the decision to transport really should be made based on what's the most medically prudent thing to do. Running for the hospital is not the best way for us to give someone a chance of being resuscitated and have them survive. Us doing the best job that we can do for that patient in cardiac arrest, right there, that's where we win a cardiac arrest, right there on the scene. And that's where we need to make sure that we save them. The other thing that's important is if we have done everything that can possibly be done, sometimes, unfortunately, people die and we can't get them back. And in many cases, it's not appropriate for us to transport that patient either. We'll spend more time talking about that in a different show.
So things have changed over the last couple of years. Out of everything that we've talked about today, I think the most important things that we want you, the information we want to convey to you, is that the chain of survival is very important. Identifying that somebody's in a cardiac arrest, calling 911, and starting compressions. Those are the 3 biggest things that you can do to help one of your loved ones, because when a cardiac arrest does happen, they're surrounded by their loved ones.
Thanks, Jack.
Thanks, Mike.
I'd like to thank you for joining us here for this brief presentation, talking about the things that are available to you in the town of Colonie, and the things that you can do to help make a big difference for yourself, your loved ones, and your neighbors. I'd encourage you, go onto the Heart Association website, buy these kits, practice them with your family, and learn CPR. can make a tremendous difference. The other thing is, get some friends together, have a party, buy some of these kits, have a CPR training party. They're not very popular yet, but I think it's going to be the greatest party you can have for 2010.
Welcome to Channel 17, the Town of Colonie Government Channel.